Diane, you want to do that?
Yeah, through you, convener. We'll now move to a roll call. I'll note that we have apologies from Councillor Dorian. Can the following members please indicate if they're present at the meeting? Councillor Brooks.
Present.
Councillor Jackson.
Present.
Councillor MacLeod.
Present.
Councillor McCabe.
Present.
Councillor J McElhenney.
Present.
Councillor Mackenzie.
Present.
Councillor Moran.
Present.
Councillor Quinn.
Present.
Councillor Rebecca.
Present.
Councillor Robertson.
Present.
Are there any declarations of interest?
Yes. Yes. Sorry. Yes. For external organisations, what's that? Item 7, I think it is. Yeah. Item 7. I'm a non-executive director at Parkway Branch now. Thank you.
Councillor MacLeod, can I confirm that that is a declaration of interest, or is it just an interest that you have in that, according to the councillor's new code of conduct?
Well, it's one of the organisations that receives funding through the Health and Social Care Partnership, and I am a non-executive director of that organisation. I thought it was right and proper that I declare that interest, as indeed I've done the same thing for meetings for many years now.
Right, thank you.
Jim?
Yeah, thanks, convener. Declaration of interest to items 4 and 7. Financial interest. My wife is an employee of the said organisation.
Thank you. All right, Diane.
Councillor McElhenney, in which case I think you may have to be put into the waiting room while that item is being...
Paper's just for noting.
Is it a noting paper? Okay.
Okay, thank you for that, Vicky. Always good to get a legal perspective on any declaration of interest. Right, everyone. Good afternoon and welcome to Inverclai Council's Health and Social Care Committee. This meeting has been held remotely in order to comply with the public health guidelines around social distancing. It was filmed and recorded for live and subsequent broadcast available through the Council website. The Council is a data controller under the General Data Protection Regulations and the Data Protection Act of 2018. We broadcast and record Council meetings to fulfil our public task obligation to enable members of the public to observe the democratic processes. Data collected during this process will be retained in accordance with the Council's published policies available through the Council's website. Members of the Council are reminded that they should follow the Council's established meeting protocols, including around the use of the chat facility, that the comments made in the chat facility are available to all participants in the meeting, and this may include members of the public who have received invites to this meeting. So that's the statement read out regarding the protocols. So as I say, just be careful what you put into the chat function, because members of the public can also access that. So with that out the road, we'll move on to the agenda. And the first thing on the agenda is the Revenue Capital Budget Report, and Samantha is going to speak to this report. Samantha.
For yourself, convener, the purpose of this report is to ask the committee to note the projected outturn for 21-22, which is a position of £44,000 underspend as at the 31st of December 2021, the current projected capital position and the current projected reserves position. I'm happy to take any questions.
Well, I don't see anything in the chat. Councillor Mackley, Councillor Mackley's indicated his hand, and Councillor Robertson. So Jim and then Elizabeth.
Sorry, convener, I was just looking for the chat button on my standalone device. It was just not got it opened yet. So yeah, it was regarding 6.3 relating to the new learning disability facility. I note the second last bullet halfway down the page where the council is investigating the possibility of funding support for the project, and the committee is requested to note that a stage 1 application to the vacant and derelict land investment programme has been successful for the council invited to submit a stage 2 application. A way back when we made the decision to close the McPherson Centre and amalgamate the service users into Fitzgerald Centre, revamped Fitzgerald Centre, it was the understanding that we made the promise that we would be building this new facility. So I just want a guarantee that the funding is not going to be an issue when it comes to that. If this grant application doesn't come through, we'll still be 100% committing to the building this new facility.
Alan Stevenson.
Convener, through yourself, I maybe invite Alan Best to initially speak, then I might come in after Alan's had an opportunity.
Okay, right. Alan Best first, then Alan Stevenson.
Thank you, convener. Yes, this grant currently, this is part of the environmental footprint of the building and exploring other ways to make the building more environmentally friendly. And colleagues within property are currently exploring that possibility, utilising grants available to make the building basically more environmental footprint. What we would do for the more upcoming health and social care committees is, once, as you know, we've given a guarantee to keep the committee updated. We will fully inform the committee as the building design starts to become a reality about how funding will be utilised to make sure the building is as environmentally friendly as it can be.
Right, Alan Stevenson.
Thank you, convener, through yourself. Just to say we did a extensive piece of work around the learning disability estate, and Councillor Macklin is right to say that the council endorsed that service review, the approach, and for us to secure a new building. So we're simply looking to take the opportunity, if we can, to attract additional funding. The service continues to work with the families. We are absolutely committed to making the hub a reality, just to give Councillor Macklin that assurance.
Thank you. Councillor Robertson, and then Councillor Beckett, and then Councillor McCabe, in that order. Elizabeth.
Thanks very much, convener. Obviously, when we're looking at this paper, one of the things I'm always drawn to is the percentage overspend and underspending. I just note that there are a few that are quite significant percentages, either underspent or overspent. In particular, 5.8, which is the 32+ % underspend in alcohol and drug recovery services. I note that a lot of that's to do with vacancies, but we have been carrying those vacancies for a while, and we've asked about them in previous committees, and it's just something that does seem to be carrying on for a long time. And so it would not be right for the just an update.
Okay, right. Anne, do you want to answer that one?
Thank you, convener. Yeah, it's around in ADRS. It's around the recruitment process. We did commence a recruitment process in July, August last year, and it's taken till now to get all the social care posts fully recruited to. There have been some internal promotions, so some of the vacancies we had were filled with internal staff, so that then created further vacancies. That's taken that time to recruit to. So it has purely been that delay in the recruitment. There are some posts that we've discovered in going through this, that there has been a post that's been coded to the wrong service, so that will be rectified, and that will have an impact on the overall budget going forward. But we are fully recruited to all those posts now. going forward, so that underspend should go down. And when we are fully recruited, the budget will be fully spent. So
Thank you, Anne. You happy with that, Elizabeth? Right, Channel.
Just
That's really helpful,
to
thanks.
say to Alan Best and both Alan. Sorry, convener. It's just to say to Alan Best and Alan Stevenson, I think that's tremendous that they're actually going up, because suddenly at the blue, everything's going to go green. And right now, they're building houses up at Tweed Street and that. And I was told that up there, the people are going to get them. They've got solar, what I thought was solar panels, but you're not allowed to go into the loft with the machinery put in there. And it's to make it easier for those houses to heat up and obviously make that generate their own electricity. I wonder if you'd maybe check what system is. Another one of the papers today we get in tells us that number 1 John Wood Street in the Port, they're going to put a heat pump in. And I think, I'm a great believer in these ones. And when you're building a building, I think we should be checking that. And I'm almost sure there's a separate part where you get grants off the government under that part of it for them. Maybe for big, we'll call it a commercial building. It might be worth checking it that way instead of thinking it's got to be lumped together. It might be you get it in different sections, Alan. I don't know if you've seen it. Okay, but well done.
Hey, thank you for that, Chana. I think that's the whole purpose of what the grant application is about. But anyway, if we're quite happy with that, I'm going to move on to Councillor McCabe. Stephen.
Yeah, thanks, convener. I just want to remind Councillor McElhenney and other members of the committee that at 4 o'clock today, the council will be meeting to confirm its budget, which will include its next 3-year capital programme, and provided within that capital programme is a sum of £7.1 million for this new learning disability hub. So the council is absolutely committed to delivering the Learning Disability Hub, and this additional funding, which I think is of the order around about £1 million potentially, would obviously help enhance the facility that we're looking to provide at Brackleston Street. So I don't think anybody should have any doubts whatsoever that the council is absolutely 100% committed to delivering this new facility.
Thank you for that, Stephen. Okay, Jim, you're quite happy, reassurance given? That's great. Well, I don't see any other questions on that report, so I'm going to move on to the next.
Convener.
Sorry, Jim McLeod. Jim.
Yeah,
Jim?
Convener, just a couple of questions, please, if you will. Under 5.3, older people. The first bullet point, it says a reduction in costs of. A projected underspend of £499,000 within external home care. I just wondered why is that so high, and if we could find out what that is and what impact, if any, that has on delivery for services on home care services. And my second question is in relation to, bear with me a second, Cross Hill Children's Home. Obviously, there has been ongoing delays for some time now, but certainly at the end of 6.2, it says the contractor has talked about the delays and has a new completion date of the 30th of March this year. I just wondered how soon after that we would actually see children moving back into the home there. Thank you.
Thank you, Jim. So the first one is the underspend for the older people, 5.3. Alan, who was Alan Best?
Yeah. Thank you, Convener. Sorry. Yes, as you know, that we have our internal home care service and we have the external commissioned services as well. And what we've seen this year and have documented previously, in some cases where our external home care provision the actual commission providers have essentially not been able to fully fulfil some of the the level of home care provision. So the internal service has had to adjust to take up that temporary sort of movement. So that would give the explanation about why our external costs have come down, but the external costs balance off that in terms of they're increasing to take up that capacity. It is a constant moving position, and we work closely with our commissioned home care providers and all commissioned providers to try and ensure we can get the best balance we can.
Thank you.
Can I just ask, as a supplement to that, Alan, so what you're saying is that essentially there's not really been any impact because internal home care has taken up, you know, any pieces of work and service that needed to be done. Can I just ask then, will external home care then increase? Do you anticipate that going back to where it was in the near future? Thanks.
For yourself, Kavina, yes, it's what we continually do is obviously the important thing is the individual, and we constantly assess their need. So it is a moving picture, but we constantly work with our home care providers in terms of their ability to increase capacity. And you'll see from the paper, there's a paper that's about to be presented, that it currently is a piece of work about tendering sort of future care at home services. So what we do is we balance off where one part of the service is unable to meet the need, the other part of the service, we look to increase that to ensure that folk are supported appropriately.
Thank you.
Alan, what about the Cross Hill?
Convener, through yourself, Anne might want to give an update on that, Anne Glendinning.
Yes, on you go, Anne. Thank you.
Thanks, Convener. Yeah, there's significant delay for Cross Hill. Yeah, the end of March is the date we've been given. Following that handover, there'll just be some internal things that we need to address in terms of just ensuring care inspectorate handover. That's all in progress. And we would hope if the completion's by the 31st of March, that over April we would move. Ideally, for the young people in terms of their needs, the best time for us would be to do that would be over the school Easter holiday period. But we will see how things go with finishing the build, getting the completion certificate, handover, registering with the care inspectorate, fire safety inspection and all these things. But all that work's being progressed so that from our side of things there shouldn't be any delays.
Thank you for that, and I look forward to the building being occupied. Thank you.
Sorry, Councillor McKay, have you ever had a question?
Was a question, it's more a comment, Convener. I was just going to say to Councillor MacLeod that item 7 on the agenda, which obviously is a private paper, will give some context to the discussion we've just had around the balance between external and internal home care.
Thanks for that, Stephen. Okay, we move on to the next item on the agenda, which is 3, and that's provisional care home services. I vote for delegated authority. Alan Best.
Thank you, Convener. What I'll do is I'll pass over this paper to my colleague Arlene Maley, Service Manager, who will be presenting the paper.
Right, Eileen, on you go.
Thank you, Convener. Yeah, the purpose of this report is to request delegated authority. As you're all aware, the provision of home care tender has went out. It was advertised on Public Contracts Scotland, and we currently have bids. It's getting evaluated at this stage. The tender agreement is due to start on the 1st of April 2022, and the purpose of the paper is so that we can ask that the Health and Social Care can grant delegated authority to the Head of Legal and Demographic Services to award the framework agreement and subsequent call-off contracts for the provision of care at home services in accordance with the contract standing orders at 17.3. Happy to take any questions.
Colin McDonald. Colin, you want to, no, yeah, sorry, Colin. Is anybody any questions on this paper?
Agreed.
We agree to delegate
Agreed.
Right, okay, thank you. Item 4 is the Dementia Care Coordination Programme update, and it's coming from Anne Merlacki. No?
Thank you. Thank you. Yep, thank you for keeping me here. Sorry, it's been difficult to get myself off mute there. So you'll have read the report, and the report is the progress report on the Inverclai Dementia Care Coordination Programme. The programme is supporting improvement and redesign of community-based services to improve the care coordination for people living with dementia and their carers from diagnosis to the end of life. The programme is now in its final 2 months and is due to end on the 31st of March. An evaluation has been commissioned by the Scottish Government to understand the impact of the programme in delivering a locally based whole systems approach to dementia care and services. The learning from the evaluation will be shared nationally with other health and social care partnerships and other stakeholders. I think it's fair to say there's a huge amount of work that's been carried out across Inverclyde with input from Health Improvement Scotland and Alzheimer's Scotland. The report shows the level of work and the detail of the work that's been carried out. And over the next month, while the programme's still running, we'll put measures in place to ensure that we maintain the improvements that have achieved, and we've got a performance framework to help us to do that. So we'll be in a good place to carry that work on. I'm happy to take any questions on the report.
Thank you, Anne. Councillor McCabe.
Yeah, thanks, Convener. I think it would be helpful for us to see the evaluation in due course when it's completed. Just in terms of paragraph 4.9, refers to a report on a dementia-friendly neighbourhood Inverclai going to the Mental Health Programme Board in March 2022. It would be useful if that report could subsequently come to this committee as well, so that we get an update. I was just going to ask a question around dementia and housing. I recently had a meeting with River Clyde Homes, and they were telling me about their dementia-friendly housing at the St Stephen's High School new build development, which seemed quite an exciting development. But they were suggesting that they were maybe struggling a wee bit for allocations. So it would be useful to understand what the sort of potential allocations process would be and what involvement your service would have in terms of that, and I suppose in terms of identifying suitable applicants for these new houses, and also about what sort of discussions going on in the context of the sort of local housing strategy about potentially more developments in incorporating dementia-friendly housing.
Anne?
Okay, so the dementia housing, we are monitoring that through the Housing Partnership Group, and one of our OTs is heavily involved in looking at the working with the RSLs to develop those houses and to look at who the allocation is. But the allocation is primarily the RSLs. They will work with the HSCP to support that process, but it is an RSL process, and the Housing Association that would manage that process. But we do work closely through the Housing Partnership Group to make sure that we're aligned and we're aware of those housing. I think some of the difficulty or the challenges with fulfilling those tenancies is around it's a fairly new process, and it's that bit about the stage at which a person is able to move to those houses. So I think it's probably something that we need to get into our housing stock, is that they are dementia friendly. All of our houses are dementia friendly, because sometimes when a person's diagnosed with dementia, it's maybe not the best time to be moving. So it's something that we need to work through. We need to get the processes in place and support people to move into those tenancies. There'll be an issue about how long a person can stay in that tenancy as well, given that it's a potentially deteriorating illness that they have. So I think it's something that we should build into all tenancies going forward, that the needs of people in the longer term are taken into consideration.
Okay, thanks for that. I think that's a helpful answer. It's obviously is important that these sort of issues are looked at in that sort of strategic way. So thanks for that response.
Councillor Brooks Graham.
Thanks very much, Convener. Yeah, this is a very helpful report. But my question is to reflect on the Fair Dementia Care Commission report that came out Alzheimer's Scotland, obviously, were the lead third sector organisation to bring that together. So within the report, we've got a number of recommendations. Every key issue has got recommendations to COSLA, to HSPC, to Scottish Government. I understand you've said that there's an evaluation process coming up. So it's a double question. Who's marking the homework? And will Alzheimer's Scotland be involved to ensure, or to not to ensure, but to see if what they concluded during their commissioned report, that the outcomes and the recommendations have been met by us? I just wonder how well will Alzheimer's Scotland be involved in the evaluation?
Thank you. So the Scottish Government have commissioned the evaluation, so they're commissioning that evaluation and taking that forward, and it's an independent company who are carrying out the evaluation. So they will be evaluating all the partners that have been involved within the service. And as Councillor McCabe, obviously we don't know the outcome of that, but as Councillor McCabe had suggested, it would be helpful to bring that evaluation back to this group when it's available.
Okay, thanks very much. Do you know whether they're going to reflect upon Alzheimer's Scotland's requests as in the report and what we've actually done? Because it'd be really interesting to see whether we've met the requirements. Requirements is the wrong word. Met the recommendations that Alzheimer's Scotland has suggested we should be meeting.
We can feed that into the, so we're involved with the group that are carrying out the commission and the evaluation, so we can certainly feed that in and ask that they consider that within the process of the evaluation.
That's very helpful. Thanks, Convener.
Thank you. Councillor MacLeod, do you have a question?
Yes, Convener. It was just about the Stephen site that Stephen was talking about earlier. I know certainly that my colleague Chris Curley, who also sits on the River Clyde Homes Board, had commented about how good it was to see the new flats at on the St Stephen's site accommodating people's needs who have got dementia. And I'd seen something similar on my visit a few years ago when I went down to Orchard View. It was just a way of making it easier for people to get around and identify, you know, where their flats and accommodation was. So I take on board what Councillor McCabe had said about actually identifying people who can go and live there. I mean, I sincerely hope it is a great success, and I just wondered, as part of the housing strategy, that if it does work at St Stephen's, would we see other opportunities in other parts of the district regarding any future developments replicating the same idea? Thanks.
Thanks. Aye. Do you think that would be things we do going forward, then? Replicating other parts of the district?
Absolutely. I think if it's a success, then absolutely, and it's something that we'll keep under review at the Housing Partnership group, and we can feed that into the housing strategy.
Thank you. Is that all right, Jim?
Yes, that's fine. Thanks. Thanks, Robert.
For nobody else in the chat, I don't think there are more questions on that agenda item. Thank you, everyone. I'll move on to item number 5, and it's implementation of Age of Accountable Responsibility Scotland Act 2019, and Anne Gledden is going to speak to us. Anne.
Okay, thank you, Convener. So, Committee of Opportunities to read the report. The Age of Criminal Responsibility Act was implemented in full on the 17th of December 2021, which in effect raises the age of criminal responsibility from 8 till 12. The whole intention of the Act is to remove children from the effects of being criminalised at a very early age. Within the report, I've attached what we call a 7-minute briefing, which really outlines the main powers given to the police under this Act, the introduction of place of safeties for children, the introduction of children's rights interviewers within investigative interviews, So overall, this is a positive report. It's a positive thing for young people, taking them out the criminal justice system at an early age, and it also has looked much more in terms of a trauma-based approach to how we work with young people in these situations, and will take account of the needs of any victims. We estimate across Scotland the likely numbers will be very small, and probably thinking around 20 cases a year, sort of maximum. So happy to take any questions.
Thank you, Anne. I have Councillor Rebecca Jarrow.
Thanks, Convener. It's a comment. If you have been made, well, if you've committed an offence, they only stay on your record for so long. And a lot of these cases, I think that'd be off. I've had a discussion with my wife, who was in that side of the police force at one time, and we're both the same thing. Because what's worrying me in this is someone from 8 to 12, and a lot of older people get these kids in because of their size and everything else, to break the law by getting into places and open the door so they can walk in. And that worries me. How are we going to help those kids? And what we're going to do to protect them? And at the same time, if there's a length of time for whatever offence it is, surely that should be off their record. Another one is, why do you have to tell them what's there? I mean, should they know under a certain age, yes, they are committed something, but they've been attended to, and it's because of, let's say, they might just have bad people that don't look after them properly. So the kid shouldn't have a brick around its neck for the rest of its life. It should be able to go out there and start afresh. We all deserve a better chance. I just worry about that. It worries me what's going to happen to the 8 to 12-year-olds and that.
Yeah.
And is there a way around it?
Anne?
Yeah, the whole ethos of this act is to protect children from the stigma of being criminalised and having that on their record. There will absolutely be provision there for children who we would then see, rather than being criminals, that those children have been exploited by adults to commit crimes, and that comes in. So help and support would still be there for young people. So it's certainly not about children slipping through the net. It's to ensure that children get the absolute right support and aren't criminalised.
That's fine. What I was worried about was the person that turns around and threatens or whatever they do to the wee to get them to do the misdemeanor. What happens to them? Because that's the big one, and it could be a parent, it could be somebody that's responsible for them, and that's the bit that worries me, because I don't want to see the wee being suffered when it's the older one that's caused all the bother, and that does happen and has happened.
Thank you for that, Charles. Jim McLeod.
Convener, there's a question in the chat from
Stephen McCabe. Aye, Stephen.
No, Councillor Brooks.
Is that not the one before?
No, it's under this agenda item, Convener.
Okay, Councillor Brooks. Bill.
Thanks very much, Convener. Children's interview rights practitioners I think is a new one been brought in by this 2019 Act. How quickly are they available? Because I wouldn't want a child to be held obviously for a length of time or inappropriately. So, and do we provide that? Is it the criminal justice industry? Do the lawyers provide for that person? Just a wee bit narrative of how that works and whether these people are readily available to interview a young person.
Yes, these people are being recruited nationally. They are solicitors and they will be available. They will be specifically trained around these type of interviews, as I said, so that there's a trauma-informed basis. So there will be absolutely no delays in young people being held for interview. The whole thing is that interviews will be planned. Chips will be available to sit with young people during the interview, and children and their parents have got to consent to these interviews taking place.
So I just add on, that's the theory of the chips. I just wonder, have you got confidence in practice that will happen?
The Act's just come in. What we're doing nationally is we are collating any local authority at the moment who comes across a child who will come within this remit. we will be learning from that. So at the moment, I'm only aware that there's one council since the Act came into place that they've had to invoke the legislation. So it will be a learning. As I said, they reckon about 20 cases a year, so numbers will be low and there will be a learning process in it.
Thanks very much. Thanks, Convener.
Thanks, Graham. And just to say, Graham, you and Councillor Brett got exact same time, 2:30. So, but Councillor McCabe is 2:33. So, Steve McCabe.
Thanks, Convener. I think that there's been general support for this change in the law, and rightly so. But obviously, the numbers affected, as the report highlights, are relatively small. But there is a view that 12 is still too low as well in terms of the age, criminal responsibility. So it'd be interesting to hear the views of the service in terms of that particular debate, and is it something that we would support a further increase in the age of criminal responsibility?
Yes, through Social Work Scotland and Chief Social Work Officers, there's certainly been discussion, and I think the thoughts are that, there's certainly been some scoping out already done around raising it to the age of taking it up to 14. So local authorities have been looking, just scoping out, how that may impact in terms of their service. So I think nationally there is a view that 12 probably is still low, and we should perhaps be looking to raise it to 14.
Okay, thanks for that.
Yeah. Right. Councillor McCabe, thank you. Councillor MacLeod.
Yes, thanks, Convener. No, I'm glad this act has occurred. I think it was the right thing to do. I think for a child who's 8, 9 or 10 to be, particularly if perhaps a crime has been fairly minor, to be tarred with a criminal record for the rest of their lives is very harsh. I think that could affect their life chances because of that. So I think certainly it was the right thing to do in passing this act. When it was being discussed, I had some concerns about it because it was a very highly publicised case, albeit in England about 20 odd years ago, where it was a young child was killed, and it was very public at the time, and that was my concern in an extreme case. How would that be dealt with? But certainly the Act, reading from what I've read, the Act does provide for dealing in any extreme cases, and so that's fine. But yeah, I think I certainly, from what I've read of the Act, I certainly welcome it, and I don't think that any child who's under 12 should be tarred with a misdemeanour. It could be fairly trivial for the rest of our days. Thank you.
Hey, thank you for that, Jim. Okay, we have that report. Right, thanks very much for that one. We move on to number 6, which is a Chief Officer report, and Alan Stevenson.
Convener, thank you. Through yourself, I was keen just to cite the committee on some of the other parts of work that the team are working on at the moment. These will all come to a future committee in fuller reports, but I think it's important to remember we're still working through, we're halfway through winter as far as the seasonal work goes in older people services, so the hospital's still extremely busy. We're a lot of work around the system related to COVID still. So, but it was just really to give a flavour of some of the other pieces of work that the team are taking forward, and the heads of service would be happy to give any further updates if required. Thanks, Convener.
Oh, I seem we've lost everybody.
We can see you.
Yeah.
Phil, you're all disappeared, wee triangles. So that's usually a sign that you've lost connectivity.
We're still here.
If you can see the chat, Convener, Councillor McCabe's got a question.
Yeah, he's coming back spontaneously. Can everyone still hear me? Hello,
Yes.
Okay. You happy to move on then? Oh, No, they're all gone again.
Convener, Councillor McCabe's got a question.
I'm just conscious, Alan, that we're losing a lot of people here.
We're not losing anybody, it's you, it's losing us all. Your VPN must be struggling a wee bit.
I'm in a house.
The VPN's maybe dropped a wee bit.
I bet it's the council's server we're using, of course. Okay, Councillor McCabe, with your question, please.
Yeah, well, just a couple of points. I suppose the first one in terms of 5.3 alcohol and drug partnership with it might be useful for Alan maybe to give a bit of feedback to the committee on the recent meeting that yourself, convener, myself and Councillor Robertson had with the Drugs Minister, Angela Constance. And I was going to ask about 5.4 in terms of additional winter 21-22 funding, if Alan could maybe give us a sort of update in terms of where we are with, I suppose, the pressures in the system and delayed discharges and the ability to deliver care packages to, I suppose, get people out of hospital, because I know there's been a lot of concern nationally about the challenges in the system, and I did a number of weeks ago attend a COSLA meeting with the Deputy First Minister where that was very much high on the agenda, how we can work together to try and address the pressures in the system. So it would be useful maybe to get an overview of the local situation.
Thank you, Stephen. Alan?
Yep, convener, through yourself, I'll take the second point. Maybe Alan Best will want to come in. Convener, you'll know that Inverclai, we've had a good track record with delayed discharge and how we perform and work really closely. It's fair to say every single partnership this winter it's been very, very difficult. A wee bit different for Inverclai. We had a wee bit up and down the last couple of months. At one point last week, we only had 3 people delayed. That's been up as high as 12 or 13. The good thing is when we do have delays in Inverclai, it's only normally a matter of days, 3 or 4 days, as opposed to people being stuck at IRH. So there's a good flow through IRH, and we had just a meeting this week with the other chief officers, and people are reporting it's very, very difficult. Our main issues have been around there's still people becoming unwell in care homes, so whenever we have an outbreak, we have to manage that, and that can slow down the ability of the care home to take in new residents. So we've got that piece of work. We've also got the ongoing issues just with care at home packages. We are very fortunate, as I said to you, that there may be a number of delays in terms of days. We don't often go into delays of weeks and weeks. We also, this winter, have used interim care beds. So if a family are so minded, we offer the opportunity to get mums and dads and brothers and sisters out of hospital in the short term for an interim care bed. So we've used these beds across the winter as well as an intermediate step back to people going home. So it's a very, very live issue across NHS Greater Glasgow at the moment about the pressure in the system, with still attempting to deal with COVID and the winter pressures. But thankfully, to give Councillor McCabe some assurance, we're halfway through the winter period now, so another 6 weeks will see us through the traditional winter period as far as it goes in relation to people being delayed in hospital. But we do very well generally in relation to delayed discharge, and we keep that flow going through the hospital, which is a big priority for us. We have staff based out at IRH who are quick to get assessments, and to be fair to IRH acute staff, they are very good at giving us early referrals when people come into hospital, and that's one of the successes of our Home First approach. We actually go hunting for referrals at an early stage so we can get that work started. So that's why we've been able to maintain good performance the last 5 years. The model we operate is we're in early, we get the early referral and we start making plans. I don't know if Alan Best has anything else you'd want to say before I move on to the Drug Minister's visit. Alan?
Yeah, thank you, Alan, for yourself, convener. Yes, I mean, Alan's kind of covered all the kind of the main points. Probably just what I'd want to add as well, and in terms of the very, very hard work and committed work that colleagues have done throughout both the current winter period in COVID, and ensuring that nobody is unnecessarily delayed in a hospital environment. And our kind of latest set of figures, when we've been looking at it compared with last year, we're actually about 30% more discharge activity than we were this time last year. And again, it's credit to the teams of hard work that's done, and also working in partnership with both our acute colleagues and colleagues across the mental health services to ensure that nobody's unnecessarily delayed because there may be an adult incapacity issue. The additional winter funding, or what we call planning monies, that allows us to focus on three main areas, which are the interim beds Alan highlighted there, and ensuring that we have a good, robust supply of care home beds that we can utilise when appropriate, multidisciplinary team working, so that's across the allied health professionals and other colleagues in terms of social care, that we can ensure that the services are provided in a timely manner, and also ensuring our care at home capacity is robust, and that includes looking at the national picture of retention of staff and development of staff. So this allows us an opportunity to take some of the lessons, the really positive lessons we've learned through this quite challenging period, and learning from them, and making sure that our systems are robust for the future. But as Alan said earlier, we're in a very, very good position at the moment in terms of the way that Inverclai performs. We'd be keen to continue with that.
Convener, can I thank the officers for that update and commend all the staff for all the hard work they're doing under exceptionally difficult circumstances to try and ensure people receive the appropriate care. But can I say I'm also severely distressed now that Alan's telling me that the winter's going to last for another 6 weeks when I look outside at the snow.
Convener, just through yourself, we can set the clock by this. We absolutely know we've got another 6 weeks to go before we deal with all the people that have come into hospital during the Christmas and early January. So from that point, the service takes a chance to take stock and then gear ourselves up for next winter. So yeah, we're halfway through, so hopefully that's some encouraging news. And maybe turning to we were in a good way. We wrote to the Drugs Minister, Angela Constance, who didn't come down. We planned to have the Minister down in Inverclai to talk about drug prevalence in Inverclai and the unique challenges that we face in Inverclai over many decades in relation to drug and alcohol abuse. We had a number of the elected members at that session, and the Minister sat attentively and listened to. We set out our stall in relation to some of the unique characteristics that we believe there are in Inverclai about drug prevalence. We talked about the things that we're doing, about looking to grow our recovery community, for example, get more people into rehab beds. At the end of that meeting, I drafted a letter back to the Minister, and we're just waiting for some correspondence back to her. We also invited her if she would consider looking at working in partnership with us around our homelessness service, because we know that the homelessness issue in our current service we want to look at modernising that service. So we've reached out through the Minister to look at would there be an opportunity for some partnership working around that. And I don't know if Anne Malarkey would like to add anything as well. Convener, Anne's the head of service responsible.
No, I think Alan's covered it pretty much. It'll be helpful. It'll be interesting to see what the Minister comes back with. I think.
Thank you.
Can I say, Convener, I thought it was a very positive meeting that we had with the Minister, and I think she was genuinely interested in listening to the challenges we've got in Inverclai, and genuinely interested in helping us to address those challenges. So it's important, obviously, we do follow up that engagement with the Minister and ensure that we can get additional support to address what is obviously a very important issue for us.
Thank you, Stephen. Elizabeth Robertson. Elizabeth.
Thanks very much, Convener. It really was. It was a really positive meeting, and I just think that having the opportunity to highlight some of the things that we know that are happening on the ground to somebody who can partner with us and making a difference with them was such an important thing. One of my questions was going to be exactly that, to talk about the meeting, but on the back of what you've just said there, Alan, we've written back to Angela. She'll come back to us, hopefully. What will happen when that communications comes back from her? That's my first question, then I'll come back to something else.
Convener, through yourself, so the letter went on behalf of Councillor Moran, so whenever we receive that letter back, I'm sure the Minister will want to engage further with us and maybe get a wee bit more detail about the specific issues around each other, whether it's about recovery, whether it's about the heroin issues we have, and about the homelessness service. So I expect we'll get some invitation to engage with the Minister's team around that, and Anne will take that into the group that is working on that work, and then we would look to we need to keep the members up to date, obviously the members that were part of that, so part of Aaron's job will to make sure we give regular updates, and if the Minister wants to meet or the team want to meet with us again as a follow-up, then we'll arrange to do that as well, Councillor Robertson.
That's really helpful. Convener, is it okay if I ask a second question?
Of course it is.
Thank you. It's about the early action system change side of things in 5.1. I think, you know, that I'm really excited by this particular piece of work. I think it's got the potential not only to make a huge difference for women who are at risk of or on the brink of the criminal justice system, but also to inform practice in other ways, because it really is about making a practical inroad into that and trauma-informed way of working that we really want to develop. The question that I have, though, is about the work directly with the women. We've obviously got quite a lot happening in phase 1 with the training of staff and the cascading of that training and all the rest of it. Is it really only in phase 2 that we're working directly with the women, or are there things happening just now with the women?
Convener, through yourself, and Glendinning would pick this up.
Yes, and please do.
Yes, I mean, phase 2 will very much be, you know, taken on in terms of training staff. I think the work with women at the moment is specifically more around, it will be individual women that the service is involved in terms of gathering their views and meeting with them. So the first, it is in the main at the moment will be staff, but, you know, be assured that there's ongoing work with women, but once we learn more, that's how we would hope to develop the service. And again, it's a great opportunity for us if we're thinking about across Inverclai as being totally trauma informed. This is another pocket where we're joining all the pieces of the jigsaw.
Thank you, Anne. Elizabeth, Councillor Brooks, Graham.
Thanks very much, Convener. Just a comment on 5.4. For the first time, I've used the service as such, and I realise we're public and obviously there will be no confidential information. Just to thank the team, just the way that Access First has worked, the communication between my relative and the professionals. And it's been very interesting being on the other side of the fence, rather sitting in a committee or a screen, to actually hear and see what the service really does for real people in the real world. So as Councillor McCabe has already said, is to pass on my thanks and our thanks to all the staff on the front line who do the actual work. And not that the officers here don't do the work, but the frontline officers, the frontline staff who do the work. And especially, we've obviously had the pandemic, we've had the winter, so I know that pressure has been on. So to pass on our thanks generally, and specifically as I've now potentially worked with the system as a user.
Thank you, Graham. Comments will be well received. We should be Alan and all his team. Councillor MacLeod.
Yes, thanks, Convener. Again, regarding 5.4, I wholeheartedly agree with the comments by Councillor McCabe and Councillor Brooks, and I certainly praise. I can't praise our staff highly enough for all the work they do, and many of you may know that because of my disability, I have some support from home care myself, and I can't praise the staff enough. They go well beyond the line of duty, so to speak, and they're very, very helpful. Just to say, I think it's great that we got this over £2 million of additional funding for the winter funding from the Scottish Government to help us, obviously, during difficult times over the winter. Just one question. I just wondered, the £2 million, 44,000, is that got to be spent by the 5th of April, or can some of that be carried over if it's not all spent? Thank you.
Okay, I don't know. Alan, do we carry the money over?
Yep.
Yeah, well, Alan, best then, yeah.
Yeah, probably Craig will come into this Convener. Thank you. This money is allocated for this financial year, and we've been working with our finance colleagues about how that will be utilised. But there is recurring money as well that will make, because the idea behind this investment is to make sure that the system is robust. So, as Alan said earlier, as we look and plan towards next winter, whenever that will start, to ensure that the system is in a good place to meet the challenges. But I think probably Craig's in a better position, convener, to answer the more details around the finances.
Thank you, Alan. Craig?
Thank you, convener. Yes, what Alan has said there is correct. We are getting additional funding for recurring funding for future years, which is fine. The funding we've had for 21-22 at the moment is my understanding is that anything which is unused, we can earmark that at the end. But obviously, we will seek full clarification from Scottish Government at the year-end process.
Yeah, I know. I mean, that's good to hear that if there is any monies, it could potentially be left over. That we can keep that, as we know that certainly in the past there was a time when previous executives or whatever was more restrictive and then it had to be returned. So I just wanted to seek some clarity on whether we're able to continue to keep any funding that it might be left over in the next financial year. Thank you.
Thanks, Tim. I don't see any other questions in the chat. In fact, Chairman, we agree that report now from the Chief Officer.
Great.
Right. To remove the appropriate